As we inch closer to COVID vaccines for children under the age of 12 being approved, the City of Toronto has surveyed local parents to understand how many plan to get needles into arms of their kids. While it's still early in the effort, it turns out public health officials still have some convincing to do.
We want to help families get fully vaccinated so that we can make sure kids have the best possible protection as well against COVID-19.
Before it's even possible to have children under 12 vaccinated against COVID-19, 1/3 of parents in Toronto have indicated they're still not sure whether or not they want to do it. 43,000 were surveyed as part of the city's outreach, which includes different education sessions, webinars, and town halls. Efforts that will no doubt have to continue.
It does show that we have work to do to provide as much trusted information and reassurance to families that we possibly can about the vaccines and about their safety.
Rollout will eventually include 230 clinics at schools in 30 priority neighborhoods, in addition to more than 450 pharmacies, private and city-run clinics. Health officials say much has been learned by everyone since late last year.
We saw reduced vaccine hesitancy over the course of our adult vaccination campaign. We saw the numbers come down. I suspect that we may see the same thing here as we will apply all the lessons we've learned over the course of the entire vaccination campaign to this latest.
I think that a lot of parents are realizing that if they don't get their kids vaccinated, eventually the kids will have COVID, and most of them will have mild symptoms, but some of them can get very, very sick with it.
About 200,000 children between the ages of 5 and 11 in Toronto will be eligible for their shots once the vaccines get approval from federal authorities.
We're in daily contact with our Health Canada partners, our Public Health Agency of Canada partners. It really does seem like by the end of the month that we'll be able to roll out the 5 to 11 vaccine for those that are eligible.
Protests against vaccines are now starting to focus on children, with a couple dozen people carrying signs showing up at City Hall today. Mayor John Tory appealing to those who may disagree to let others decide what's best for their own kids.
I can't imagine anyone, no matter how strong their views are on these issues, wanting to make pawns of children where their parents have decided that it is in the best interest of the health of those children and of the schools and of the city as a whole to get vaccinated.
As vaccines were being rolled out for adults earlier this year, you may remember supply being an issue at first. I asked Dr. Davila whether there would be problems with the new pediatric formula this time around. She said she's heard from her federal and provincial counterparts that it shouldn't be an issue.